So good morning and welcome. I'm very excited about the conference and I'm looking forward to the next 2 days. I'm Nicole Mason and I lead the Institute for Women's Policy Research. For those of you who may not be familiar with our work, we produce rigorous evidence-based research to inform policy outcomes at the federal and state level, and we also work to win economic equity for all women. This conference has been a long time coming. We started planning it right in the middle of the pandemic. And we believe that we had a real opportunity to bring the best thinking together, from researchers to advocates to practitioners, to think about how we might transform the US care infrastructure. I believe we had a small window, and I still think we do, to put forth the best ideas about how we might create a system that works for families, works for the economy, and works for workers. And here we are. I want to start out by thanking American University and Mika Muirs and Pravina Bandara and our colleagues at the Care Network, especially Mignon Duffy, for being such great partners on this effort. I also want to thank our current and former staff for bringing this conference to life. Ariane Hedgewick, Eve Medford, Georgia, Georgia, I'm so sorry about your last name, Shungwei Sun and Jeff Hayes, and Olivia Stores, Sophia Ladner and Will Lutz for being here today and their help, and to Caro as well. And also, lastly, I would like to thank the American University graduate assistants, catering and AV staff, and all the esteemed speakers, both in person and virtually. Lastly, we had a really great and big victory. I want to take a moment to thank and recognize Councilmember Elisa Silverman, who all the work of the DC Paid Leave campaign. We recently won expansion of DC Paid Leave program to 12 weeks. It's a really huge victory. And as we think about, and what I want to connect the dots in this moment, as we think about the care infrastructure and policy gets stalled at the federal level, think about how states can become laboratories for innovation and help move some of the policies we know that will make a difference for women and families forward. I also want to acknowledge, before I turn it over to Mika, Mary Hansen, IWPR board member, who's also here in the room today, and Elise Shaw, a former IWPR staff member who's also joining us today. So with that, I'll turn it over to Mika.
So thanks so much, Nicole. So as Nicole mentioned, we started planning this conference over a year ago in an effort to use this historical moment to push forward the US care infrastructure agenda. At American University, Professor Maria Floro was wrapping up the Hewlett Foundation funded project on care work in the economy, which developed tools for integrating care into macroeconomic models. So we feel that integration of care into macroeconomic models is really crucial for centering care in economic discussions. But of course, at the same time, the more detailed analyses of specific labor markets and policies and client needs are also really essential to that discussion. So we're really looking forward today to our exchange and to the efforts and successes that will grow out of these exchanges. This is our second joint conference with IWPR. We had the Pathways to Gender Equality conference together in 2018. It's always a great pleasure to work with IWPR, bringing together our respective academic, advocacy, and policy communities to have discussions about these issues, which I think provide really unique opportunities to think about the big picture. So I hope that all of you who can will stick around for the reception that will be this afternoon from 4:30 to 6, so that we can have some more informal exchanges about these issues. And lastly, I'll just thank our graduate assistants specifically and by name. So today we have Aina Krupinski-Puig and Pravina Bandara, who was already thanked by Nicole. And tomorrow we'll have Beatrice Neal de Souza and Barbara Broussard and Nick Wynn. And I think Barbara and Nick are both here today. So maybe they'll be helping today too, I'm not sure. Okay, so thanks so much and have a great plenary.
Okay, so I'm back. So I've been charged with moderating the opening panel and helping to frame out our discussion over the next couple of days. I'm really looking forward to moderating our panel today. And with colleagues that I've worked with, Melissa, for a very long time on many of these issues, and really thinking about how we build a robust care infrastructure in the US. Before I turn it over to the panelists to talk to you more about their work, I want to provide some context and punctuate the urgency of this moment. So following the most recent election, I remember zooming into a meeting wearing a shirt that read, "Good things are coming." I was, I was heady with the possibility of transformative change. Would we get paid sick leave, universal childcare, or an increased minimum wage? For me, it was all on the table. As an advocate who has worked for more than 2 decades on these issues and others, it felt like our time had finally come. On the issue of care, I absolutely believe the pandemic had revealed the brokenness of the system. Care, or the lack thereof, was among the chief reasons women fell out of the workforce in significant numbers. By April 2020, about 60% of childcare programs across the country were fully closed by April. And some are still shuttered or face barriers to reopening to their full capacity. A little more than a decade ago, I was a single mother by choice to twins. Following my maternity leave, I searched in vain for high quality, affordable childcare in New York. If you, sorry, in New York City, I mean, come on. The sticker shock, about a third of my salary at the time, and the year-long wait list made me wonder how other moms and families did it. Was I missing something? I couldn't afford to stay home, but I couldn't afford care either. A couple of weeks before I was scheduled to return to work, my paternal grandmother flew in from California, and she had to be in her late 60s, to help care for the twins. She became their full-time unpaid caregiver. The 4 of us, along with my cat and dog, lived in a tiny 1-bedroom apartment in Brooklyn, New York, making it work the best way we knew how. She stayed with us until the twins were 18 months old. Without her, I would not have been able to return to work and to a career that I loved. When she left, I found the Red Apple Daycare Center in New York's Chinatown. It was the cheapest. I mean, it was a long search, and shuttled my children there early in the morning and rushed to scoop them up before being charged a late fee. When I stayed late or traveled for work, I relied on a makeshift system of family, friends, and babysitters to make it work. Between full-time daycare and sitters, it was nearly impossible to make ends meet. As you know, although families can spend up to 30% of their income on care, child care workers make about only $10.72 an hour, some earning below the federal minimum wage. Many work 40 hours or more a week, some less, with few to no benefits or job security. Most care workers are women of color, people of color, and a third are immigrants. It is estimated that over the next 15 years, we need 4.2 additional care workers to support our aging population and more to care for children. These are the facts on the ground. However, what we know is that the care system that we have is not working for mothers, not working for workers. See, it's a slip. Mothers, particularly our most vulnerable workers. If we invest in our child care infrastructure, we can lift women and families out of poverty by paying higher living wages and providing benefits, such as paid sick leave, health insurance, and health insurance. This is money pumped right back into the economy and directly into communities. In the US, care is treated as a private obligation of families rather than as a public good that benefits society and the economy, and that allows women to sustain employment and advance in their careers. The United States is singular among developed nations in terms of how much invested in care and supports for families. As a country, we spend less than 1% of our GDP on childcare and early education, only above Turkey and Ireland. The US could add $1.6 trillion to the GDP if women entered and stayed in the workforce at a rate similar to Norway's, which has government subsidized daycare. So we should and can do better. If we invested in a child care system or a care system where no family spent more than 7% of their income on care, families can invest more in their dreams, home ownership, or save for their children's college education. For the most vulnerable families, they would have an easier time making ends meet and putting food on the table. It would also save families more than $96 billion a year and more than $957 billion over 10 years. And it would also be a boon for the economy. In our panel this morning, I'm looking forward to hearing from our panel, our experts, and not only what they are seeing, the diagnosis of the problem, but how we might be able to get where we want to be and defining it for us along with the strategies for how to get us there. So with that, I want to introduce our panel. So, sorry, I have to get the bios. Where are the bios? Okay, here we go. Here are the bios. So I'm going to start with Gary. Gary in the middle here. Gary is the CEO and co-founder of Promundo USA, which has worked more than 10 years in nearly 40 countries and is a leading global voice in engaging men and boys in advancing gender equality and positive masculinities. He is an Ashoka Fellow and received the Voices of Solidarity Award from Vital Voices for his work to engage men for gender equality. Next to me is Melissa Botea. She's the Vice President for Income Security and Child Care Early Learning at the National Women's Law Center and oversees their advocacy, policy, and public education strategies to ensure that all women and families have the income and supports they need to thrive. Next on the script, not with us, this hybrid moment here, we have Lina Bracero. She's SEIU's National Political Training Director, where she designs curricula and skills development programs for members and staff. She also manages local and federal strategic partnerships for legislative, electoral, and issue campaigns for the union. Also joining us virtually is Mignon Duffy. She's the co-chair of the Care Network, a national organization of Carework researchers and advocates. She's also the author of Making Care Count, 100 Years of Gender, Race, and Paid Care Work, and co-editor of Caring on the Clock, The Complexities and Contradictions of Paid Care, which collects cutting-edge research across a range of care work occupations. Also joining us virtually is Jocelyn Frye. Jocelyn is the new president of the National Partnership for Women and Families. Prior to taking the helm at the National Partnership, Jocelyn served as a senior fellow at the Center for American Progress. Before her time at CAP, she spent 4 years working in the White House under President Obama, serving as Deputy Assistant to the President and Director of Policy and Special Projects for Michelle Obama. And then we have Elaine Magg, who's a Senior Fellow in the Urban Institute, Brookings Institution Tax Policy Center at the Urban Institute. It's a very long program title. She is an expert on tax policy for low-income families. Her work focuses on the distribution of income and benefits for low-income people and people otherwise disadvantaged in the labor market. Prior to joining the Urban Institute, she worked at the Government Accountability Office and the Internal Revenue Service as a presidential management fellow. So we have a really good panel here. Yeah. So what I'm going to do, I'm going to start out by posing a question to each of the panelists, and they're each going to take 5 or 6 minutes to answer the question, and then we are going to have a discussion, and then we're going to open it up to the audience for questions and answers. Does that sounds good? Okay. So I'm going to start with Mignon Duffy. Mignon. Okay, so I'm going to look here now. So can you talk a little bit about the role of care researchers in moving policy forward in this particular moment?
Sure. Can you hear me? Hello? Can you hear me? Hello?
I can hear you.
I think she can't hear us.
Can she hear us? Mignon, can you hear us? Thumbs up or?
I hear you, yes.
Yes. Okay.
It looks like the.
But you can't hear us?
Her too, and it's just us who can't.
Can you hear me?
It looks like the Zoom people on Zoom can hear us.
Mignon, can you hear me? I can hear you. This is Lina.
Well, you know what? We just keep the show moving. I'm going to turn to the people who are actually in the room, and I am going to Gary. Let's go on to Gary.
Ooh, I thought I had a moment to breathe. Okay.
I know you were. So Gary, so what is the role of men and male caregivers in achieving care equality? Or, what are we in the US? Where are we in the US on this topic, and where do we need to move?
Okay, thanks. I'm going to start off with since you empowered us to start with a personal story, I'm going to start with just a 1-minute story of kind of how I got to this topic, among other reasons. About 20 plus years ago, my Brazilian wife and I moved to Chicago when I was working on my PhD. Any of you who are doing grad studies will not think this next part makes very much sense, but we decided to have a child while I was in grad school. My wife was the main breadwinner. She's a therapist and a public health specialist. And when we, were expecting the child, she looked at the benefits that were offered and she said, "How have you brought me to this backward country that has no leave?" Brazil has 5 months paid leave for mothers and now 2 weeks paid leave for dads. That's now expanded to 4 weeks. So I had an interesting moment of being a stay-at-home father for part of the time, and we had a nanny part of the time. And two things happened to that helped kind of frame what the organization Promundo does. One was there's a lot of folks who assumed that I was an incompetent parent and use verbs like, you're babysitting, or how nice of you, or please pass this information to your wife, because I couldn't possibly remember what medication to give, a child, et cetera. So there was that you're incompetent, and lots of women offering, "Can I take the baby off your hands?" And then a lot of other ones that were, "You're amazing, look at this, you're doing fantastic stuff," and thought, well, no, I'm just being a parent, and being competent at this is a pretty important skill for most human beings. So both of those things were among the things. My daughter is exactly the same age as Promundo as an organization. When we started it in Brazil and then opened the US office. So just going through that quickly, just to say, I'm here because I had a lot of hands-on of this lack of care infrastructure in this country. And it's thrilling to be in a group that is trying to put this at the center of it. So Promundo has tried to put this kind of radical and sometimes impossible, or thought to be impossible, idea that men could do 50% of the care work. We've done a lot of talking about what we need for a care infrastructure. There's not a lot of putting the care equality part there around believing that men can be nudged, obligated, supported, all those verbs and more that we need to do to get men to do 50% of it. It's easy to be pessimistic about that, and we do a lot of data analysis internationally and a little bit nationally. Our last calculations for the State of the World's Fathers report, we do every 2 years, looking at what global data is there, sometimes gathering new data. The last analysis we did of ILO time use data, where there's at least 2 moments in time from recent data, 30 middle income and upper income countries show us that we are getting it. Men are doing a few more minutes that we're measuring over time. And if we look at the rate of change, at least pre-COVID, we're about 92 years away from equality. Not a very encouraging, I know that's difficult to say we could achieve equality, but it is a moment to say, what do we need to do to get there? Obviously, the IPWR folks have done some analysis of US time use data and found, if I recall, 37% more that women are doing on a daily basis pre-COVID, and then COVID came along, and what's up? It's unclear, I think, and love to hear from others of we know a lot of things are clear, the burden on women, the job loss on women. What some of the data tells us is we did a survey together with Oxfam US, a relatively quick online survey, reasonably representative numbers, showing that a slightly higher percentage of men say they're doing more or increase their time spent on care work compared to women, but that was already on top of the inequality. Then we asked the effects of that additional time. Women, of course, said, I say, because this is kind of obvious, the fatigue, the lack of personal time, the increased weight of the time use, and higher rates of depressive symptoms, even higher among women of color and low-income women. Interestingly, men told us, nearly half, that they were happier in having to do more time use around care work. Now, we have to ask what were men doing that they're saying. I don't know that they're saying I'm happier doing cleaning the toilets and things like that, but the time spent in caring of children as a positive thing for men. And I've had a number of men colleagues tell me during this time I was doing some of it before, but I really got into the daily kind of nitty gritty of it in different ways during COVID. Obviously, lots of men not able to do that because they've had to double down on work. But I do think there is a moment here. And some economists have said there's been something like an obligatory paternity leave for lots of men in this country and around the world during COVID. So I think the question is what comes out and what do we do next? On parental leave, and that's something we've done a lot of research around. We've looked at both European countries that have done this for a long time. We've advocated for expansion of it in Brazil, where we started our work. We supported, well, then Councilmember Bracero, and did some of the testimony. We did some testimony and added some text there of what some of our data was telling us about it. What we found is that even in the countries that most offer it, men have never taken up their 50% in countries that make equal days available. So the Nordic countries, even there, men are not taking their full amount, whereas women, for the most part, are taking 90+% of the days that are available. We've done survey research in about 13 countries on this, upper income countries, including the Nordic countries and some middle income countries, Brazil, Argentina, et cetera. And what do we find? The main reason that men don't use the full number of days, fairly obvious again, whether it's middle income men or upper income men or lower income men who have access to it, is they worry about their career trajectories. They worry their pay will suffer, to which we want to say, welcome to what women have faced for how many decades do we, come on, men, let's not make this into a, but it does tell us the need for the structural changes that we have to do to change what the world looks at men. And of course, to do this together so that women and men feel like we can all take that leave and feel supported in it, and that our career trajectories don't suffer. The other issue, of course, we have to look at is the norms around care work. This, of course, we affirm how much it has been carried out by women, but it really is difficult to try to break that gender binary to see that care is not only feminine, it's human. And how do we encourage boys and men to do our part? One of the issues we did a study on self-care and the connection between self-care and care for others. This was done fall of last year, a national survey in the US comparing men and women on self-care and the participation in care of others. When it comes to self-care as yoga, exercise, treating our bodies right, women and men are about equal in the country. A lot of attention to that during COVID. It's a good thing in terms of our health. Then we talk about other forms of care. Do you seek help when you need it emotionally, or you feel the need to connect with others? Women at about twice the rates of men. So if care is we care for our bodies, men are doing that better these days. When it comes to caring for our mental health, men are still not very good at it. And then if we look at who cares for others, we see that huge gap as well. Men who were more attuned to caring for their mental and emotional needs tend to do more of the care work. So again, this issue of, something about how do we get men to be attuned to what the human need and capacity for care is, and how do we start that even earlier? So yeah, I guess the big question is, what do we need to drive men's participation in care work? I think a lot of the conversations, there's some good ones happening. There's fathering together. There's now all kinds of newsletters for dads. There's dads blogger groups that come together. There's corporations who have figured out that dads are buying products and they need to figure out what's up with fathers. We do a lot of partnering with some of those, P&G and Dove Men Plus Care brand. There's a lot of celebrating celebrity fathers who are doing the work, all to which I will say great, but not nearly enough. We still kind of get in that individualistic notion. And most of this is celebrating middle-class or upper income fathers. Fantastic as well, but certainly not enough. And then we have kind of the tail of the other fatherhood in the US, which is low-income fathers, often non-residential, and all of our racist baggage around the deadbeat dad instead of understanding the dead broke dad. What is going on there that we need to support? Income support, social protection policies that understand that men's participation has to do with their economic support and their feeling of, as it does for women, to include men in that conversation there. So where do we go? I mean, there is not at the moment, I would say, a platform somewhere that says we believe men can do this, but we need to put in place a series of policies to make it possible. Could we get some affirmation that we believe men could do 50% of this? Put out some policy targets that we think that's possible? Could we get men's participation beyond kind of the men as champions, and that we kind of get this undue applause if we do what should be considered the normal work for us to do? Can we use prenatal visits? Can we use the daycare infrastructure that needs to be built to send signals that we want men as part of that? And I would also like to say we want men as voters and as politicians doing this. I hear again and again, we need women. So I've heard this in Scandinavian countries, hear this in Latin America, hear this in the US. We need women politicians to support the care infrastructure. We need women politicians, period. And that sentence can stop right there. but I want to see men involved in this. It feels to me at times as if we say this is a women's job to do the advocacy. After you've already done 60% of the care work, you also have to carry the load in doing the policy advocacy on this. So I just want to end on that I want to see men putting their political stake, policymakers at the, let's say this, the city level, the state level and beyond, putting their stake and saying, I have an investment in the care infrastructure. Men need to be part of this. From at home to our state houses. And I'll stop there. Thanks.
Gary, it's like, where have you been my whole life? And I just can't wait to dig in to some of the things that you spoke about, the structural change, like how do we set a target? How do we increase engagement, challenge gender norms and expectations? I can't wait to dig into all of that. So I want to turn to Mignon and see if she's.
Can you hear me now?
We can hear you.
All right,
Barely.
fantastic.
I'm going to try to turn it up a little bit so we can hear you in the room.
Just tell me when you're ready.
Can you say something now? Sorry.
Sure. Do you need me to keep talking? Is that better?
Mignon, can you say something?
Sure. Are you able to hear me now?
If we're really quiet, we can hear you.
Silent? You can hear me speak?
I'm gonna try to run around a speaker someday.
Okay. So Mignon, we're gonna go to Melissa, and he's gonna try
Okay.
one more thing. I'm sorry. I know you're.
This is very pandemic on brand.
On brand.
We're still figuring
Well,
this
we're
out.
still figuring out
Yes.
And I'll be back. I have to grab something.
we're living in the hybrid world. So Melissa, I'm going to go ahead and turn to you. So why don't you tell us about the state of childcare in the US and what evidence do we have that it's affecting women's ability to keep and find paid work, which it seems like a setup question. We already.
Yeah. The state is bleak and we have a lot of evidence. So I can go a little bit, provide a little bit more details into those comments. And if you'd like, I can talk a little bit about sort of where we are in a big push to hopefully resolve some of those things. So also opening up with a personal story. After I had my children, I had a workplace that offered paid leave. And I also was not able to find high quality childcare. And also my mom had to come and help me and all of the different things. But one of the things that I appreciated about my workplace is that in addition to the paid leave, I had a lot of flexibility. There was a lot of sort of support for, transitioning back as a new parent, all these different kinds of things that you hope would be there for everyone. But as my former boss, Near Tandon, used to say, you shouldn't have to win the boss lottery for that to happen. I think part of and you're more likely in a white collar job, in a job where, there's, people who have a college degree to have those kinds of benefits, as opposed to for women who are in low paid jobs, again, overrepresented by women of color. And so again, this should not be something where, oh, I got lucky, I got a boss. These are basic rights. And so part of what we've been trying to do and what the pandemic, the silver lining is that it is laid bare just how broken our care infrastructure is in this country. And it's at the same time, sadly, exacerbated it to the point where if we do not make public investments, we're really at risk of setting women's gains back a generation. And that's both a challenge as well as the opportunity that we have to really change the underlying structural issues as opposed to just put Band-Aids on things. So I'll start a little bit with childcare as an industry, which is that, as I think Dr. Mason really underscored, it is something that people have long thought of as a private responsibility, when in reality, it's a public good. How many of us have had the experience of sitting there, what's wrong? Why can't I figure this out? Like, what is wrong with me that I can't find affordable, high quality childcare in New York or DC or wherever it is? And if I can't figure this out, what does that mean, et cetera, and internalizing it and finding shame and stigma in it. All it takes is a quick look at the data to realize that this is a broken market. This is not an individual problem. So childcare, for context, operates on razor thin margins as an industry. This is an industry where over 90% of the workers are women, and they are disproportionately Black, brown, and immigrant women. They are paid poverty wages for doing the essential work of holding up our economy. And I think all we have to do is see what happened. We had a sad natural experiment at the beginning of the pandemic when childcare wasn't available. And we saw mass exodus from the labor force. And we know that it is a central economic issue that holds up our economy. And yet, women who are childcare workers are twice as likely to rely on public assistance and be in poverty. And so there's a lot of research about now people are leaving the field because we're still 12% below pre-pandemic levels of childcare employment. And there was a recent study from Wells Fargo, not a bastion of liberalism, showing that nearly 500,000 parents are stranded without childcare because of this. And so what's happening? Well, there was actually an article in the New York Times last year that really struck a chord with me, where you had a woman who was a childcare provider and then worked part-time as a Starbucks barista. And she said, I get paid $10 an hour to educate the next generation, and $15 an hour. That's not to say that people working at Starbucks shouldn't be making even more. But it's saying that how much we disparage work that is performed predominantly by women and disproportionately women of color and immigrant women, and devalue it precisely because of who does it. And we have a very long history of doing that in this country, dating back to when enslaved Black women were forced to take care for free of the children of white plantation owners, all the way going up to the New Deal, where we had an opportunity to actually put labor protections in place. We did it for some sets of workers, and in places where there was domestic work or agricultural work where Black women were overrepresented, we chose not to give those protections. And so we have a long history of devaluing care work in the United States based on race and sex. And so that is a history that we have to grapple with as we are sort of headed into this opening that we have, this unique opening to actually change things. And I want to put the labor supply side over here for 1 minute and then look at the demand side. Because as Dr. Mason and myself, anybody who has kids knows childcare is not affordable. It is, there was a recent study put out about 2 weeks ago by Childcare Aware of America, where they showed that in every region of the country, pretty much, it costs more than in-state college tuition. And in 3 out of 4 regions of the country, it's more than rent. There's the recommendation is that you pay about 7% of your income towards childcare. I do not know anybody who pays 7% of their income towards childcare. And nationally, it's hard to use national numbers because regional markets are so different, but it's about 10%. And for single mothers, it's about 1/3. So you're really right on, you're living the data. That is true nationally. That is not sustainable. And because it's such a razor thin margin, we cannot ask parents to pay more. They already can't afford it. We can't pay providers less. And in fact, we should be paying them much more. And so what we have, right, again, is a broken market. And what you need then is a third-party payer. You need to reconceptualize childcare as the public good that it is. And that third-party payer is the government. And for too long, we have just disinvested in care. Again, grounded in all these racist and sexist, conceptions about the value of care work. Right now, only about 1 in 8 people who are eligible for childcare assistance gets it. And that is a very low eligibility. And again, we're looking at a time now where the childcare workers they don't want to leave childcare. Many of them, you talk, they love caring for young children. Like childcare workers are very special people. Early educators, like everyone I've ever known is just phenomenal and highly skilled. But if you can't even make ends meet for your own family, you can't stay in this field. And so you have the providers leaving, the parents can't afford it, and it translates into this mass exodus of women in the labor market. And some of the research that we've done at National Women's Law Center has underscored that this is not only a problem for women's economic security today, but it has a lifetime worth of consequences. And on the flip side, if you invest in childcare, it has a lifetime's worth of benefits. So we did a study with Columbia University Center for the Study of Poverty. And we found that if you were to invest in affordable, high quality childcare for everyone who needs it, you're going to see women earn $100,000 more over their lifetime. You're going to see another $30,000 in retirement. You are going to see the gender earnings gap close. You are going to see especially racial and gender gaps close in retirement and wealth building, because it means that more people can pursue the career that they want or stay in the labor market and compound those earnings over their lifetime for Black women in particular. And so childcare is a gender and racial justice issue. It's an economic issue. And it's one where we have a very special window right now where everybody kind of woke up at the same time and said, oh my goodness, like if we don't get this right, this is going to have long-term implications for our entire economy as well as for our families. And so right now, a big part of what we're doing is working on that. There's, a lot of news about the negotiations with the act formerly known as Build Back Better. It's like I have called for calling it the Primal Scream Act of 2022. No one has taken me up on that so far. But we are, if this were to be enacted, and that's to be determined. But if it were to be enacted, it would provide universal pre-K. For 3 and 4-year-olds. It would cap how much families pay for childcare at 7% of their income. It would be free for lower income families with a sliding scale. It would finally pay childcare workers and early educators living wages and put them on a path of wage progression with elementary school teachers if they're similarly credentialed. And it would build the supply, because half of families right now live in a childcare desert where there's not even enough supply if they could afford it, and they can't afford it. So this is the answer we've been waiting for. Will it solve everything? No, but it would build the care infrastructure for childcare that we could build on for generations, and that would largely make enormous inroads in this challenge. So I'll stop there, but thank you for this important conversation.
So I tell you, this is like the funnest panel I've been on in a while, especially in person. And I just want to thank you for providing both a historical context and an intersectional, very nuanced understanding of how we got here. And also being able to connect the dots between, women's career mobility and earnings and the lack of childcare, which, Gary, also helped us thinking about why men don't want to take leave, or reluctant to take leave. So are we going to try again for Mignon? This is like the third time, so perhaps this is the charm.
Third time's the charm. Can you hear me? Hello? Apparently you can't hear me.
I can hear you, Mignon, but I don't think it matters.
I don't think the people in the
They
room
can't
can.
see me or hear me. So.
I know.
So I got all pretty for nothing.
You got all dressed up this morning. You took off your pajamas.
I know. I feel a little like somebody owes me half a day in pajamas. Well, they're clapping, but I don't think it's for us.
No, I don't think so either. The Zoom people can hear.
Oh, they can hear us.
I don't think we can hear them.
Oh, I don't think so either.
Yeah, no, I don't think.
Good chat.
Okay, hopefully this is, reviving now. Okay, so you probably forgot the question, Mignon. So
I actually couldn't hear you. You cut out for a while. We couldn't hear you at all.
The question is, what is the role of care researchers in moving policy forward and helping us to understand this historic moment
Okay.
in your work?
So I really appreciate the other two panelists for really emphasizing the gender and race dynamics of the devaluation of care and making strong arguments for dismantling those, as well as increasing public investment. And what my role is, since I was supposed to be the first speaker, was to kind of take a bigger picture lens. And so I'm going to kind of pull us back out a little bit and focus on the role of research in framing ideas rather than kind of the nitty gritty of policy proposals or the other roles of research. So what are the big ideas that care researchers should be focused on moving forward to support policy change in the US and around the world? And I've just finished listening to 3 days of wonderful speakers and thinkers on this very topic at the Carework Network Virtual Symposium. So a lot of the ideas I'm going to share come from that and from the collective wisdom of that group, although they're my interpretation. So first, I think it's important to say that there are some big ideas that care scholars and advocates have been working on for many years that have gotten, as the other speakers have pointed out, a lot more traction in this pandemic moment. The very idea of this conference, Care as Infrastructure, is one that has been around in research and advocacy circles for a long time, but has only just become part of the broader public discourse in the past couple of years. So it takes some time sometimes and the right historical moment for big ideas to get the right kind of attention. But the groundwork for those ideas was laid long before by many of the people in this room. So what are the next big ideas? Where do we need to start laying the groundwork now? I'm going to briefly touch upon 4 areas for care researchers to consider that, in my view, the pandemic has broken open and exposed the need for further thinking. The relationship between paid and unpaid care, the role of technology, the role of the state, and the relationship between care and taxes. So there was a lot of talk during the initial stages of the pandemic lockdowns about parents suddenly having to homeschool their children. But we all know that for the most part, what parents were doing was not in fact homeschooling, nor was it the same as what teachers do in classrooms. Pat Armstrong and Jana Klosterman have written about the role of unpaid labor of family members and volunteers in Canadian nursing homes that became visible only when pandemic restrictions made it disappear. What these examples and many others point to is the need for us to think more about the nature of the relationship between paid and unpaid care. While there are some elements of substitutability in care labor, to think of these as simply substitutes is a gross oversimplification. Even the stories that all of you have told about your own care narratives are a very complicated mix of paid and unpaid care provision. So what we need to understand and theorize better, what different kinds of skills and knowledge do paid and unpaid carers bring to the table? And how do we create systems that honor the collaborative relationship between paid and unpaid carers and avoids coercion or exploitation on either side? Second, the pandemic forced us to consider very differently the role of technology, as evidenced by this panel, across all aspects of our lives. So how can technology be used to create access to care for marginalized populations? This can be, of course, for those who are geographically remote, but also for other reasons. For example, Alison Pugh has pointed out that veterans may be more likely to access mental health services online because they can avoid the stigma of walking into a clinic or physical space. But then we also need to think about what are some of the unintended consequences of using technology in care. Mercer Gary has found that telemedicine in practice relies on the precarious work of an army of low-wage workers who become invisible in satellite clinics, for example, and displaces some labor onto patients and unpaid caregivers. There are also ways in which technology can accelerate or amplify cultural meanings around care, for good or for bad. One of the things that happened during the pandemic was online platforms like care.com that are labor markets for childcare exploded and grew rapidly. And Julia Tacona has found that the setup of care.com perpetuates cultural messages that the populations that make up the majority of childcare workers are not trustworthy. The same messaging that underlies surveillance technologies such as nanny cams and daycare reporting applications. This is an area where we've barely begun to scratch the surface and need to do a lot more thinking about the role of technology in care as we move forward. The third big idea is one that scholars have done a lot of thinking about, and that is the role of the state. There's a rich history of feminists theorizing about the welfare state and care, but the pandemic opened up new questions. So in my city of Lowell, Massachusetts, as in many cities, a large and well-coordinated mutual aid effort emerged near the beginning of the pandemic to fill the gaps that governments were not filling. This week, I learned from Liz Isidro Ferrer about the long history of Ollas Comunes in Peru, similar community-based mutual aid organizations that expanded their work during the pandemic. And she argues that we need to move towards a collaborative model in which these kinds of community organizations are co-producing care infrastructure with the state rather than filling gaps or enabling the state to get let off the hook. And this is the kind of thinking we need more of post-pandemic. How do we both hold the state accountable for care and create collaborative spaces for communities, businesses, and families to partner in a proactive way? Juliana Martinez Franzoni has argued that the creation of a new kind of social contract that shows that governments can partner to provide basic care services, maybe one step towards bringing back some of the legitimacy that the state and government in the US and elsewhere has lost in recent decades, and especially during the pandemic. So that's one line of argument that might be worth following up on. The final big idea that I believe we need to think more about is taxes. The Build Back Better plan has stalled largely because, at least nominally, of concerns about cost. We need to continue to make the argument that care is a public good and that investing in care infrastructure leads to good outcomes across society. But we also need to more directly challenge the prioritization of the accumulation of wealth in a neoliberal economic model. Joan Tronto has argued that until we challenge this value system directly, we are going to continue to lose in fights about investing in care. To my mind, the most direct way we can do that is raise our voices, new ways of articulating the important role of fair taxation in creating sustainable care systems in the context of gross levels of societal economic inequality. Taxes are not sexy, but we have to talk about them, and we have to talk about them in relation to care. There are, of course, many areas that are important, but these are just some thoughts about areas that we need to explore more deeply, and I offer them in the spirit of generating some dialogue, and look forward to hearing what all of the rest of you have to say, and thank you for the invitation to participate.
Thank you, Mignon. And I tell you, I love anybody who can string together accumulation of wealth and neoliberal economic models, and just it flows in a conversation about care. So I want to turn to Jocelyn Frye, and I would love to hear, Jocelyn, if you can talk about care policies in Black women and dig a little bit deeper in what we've been seeing. Again, Melissa pointed out that Black women, women of color are overrepresented as care workers in the care sector. So would love to hear what you might have to say about that.
Thank you, Nicole. I hope you can hear me.
Yes.
You may not be able to, can you see me? Oh, haha. Ooh.
I do the same thing as soon as the camera comes on.
Thank you. I feel very fancy, like I am very technologically sophisticated. So thank you. And it's great to hear all of the panelists and to be here with you, Nicole, and all the folks in the audience. And I really will just pick up on some of the things that Melissa said. I thought it was a great summary of care. And I think where I want to start is say that in many ways, when you ask about care policies for Black women, on some level, the answer is there are no care policies for Black women, right? Like the history of care is rooted in this notion that Black women were supposed to perform care for other people, but not spent any time focusing on care themselves. And, that is deeply rooted in our history around sort of our views about care, and to the extent that other women of color were also asked to provide care. And even when white women were providing care, the notion is that it's, something that women do, but something that doesn't really have value. And that analysis has stuck with us. I think it is ironic that, Black women consistently have the highest or among the highest labor force participation. That has been true throughout the entire pandemic. It continues to be true as of the latest job numbers. At the same time, they also have higher unemployment rates. They, face racism and sexism in the workplace. And so it is in many ways this perfect storm. On the one hand, being expected to work with little regard to their care needs, but yet filled with a whole bunch of assumptions about the value of the work that they bring to the table. And so as a result, we don't have as much as we should in terms of the supports for Black women, for other women of color, in terms of the care needs that they have and the supports that they ought to have access to. I would say a couple of sort of other quick things is that for Black women, one of the things about the pandemic that I think is important to note is that even though we talk a lot about all the women who've left the workforce, which is really critically important, there are also a chunk of women who stayed in the workforce, and they stayed in the workforce because they had no choice but to stay. And if they could stay, it was more often because they were essential workers who were disproportionately women of color, and that's certainly true for Black women. At the same time, for Black women, they, and particularly Black mothers, they are disproportionately caregivers. Over 80% of Black moms are either primary, sole, or co-breadwinners for their families. So contextually, and I think if you also look at Black families generally, about 40% of those families are headed by Black women. So there are a whole host of reasons why they need care supports. At the same time, because they are disproportionately in lower wage jobs that lack the access to paid leave, paid sick leave, all of those sort of paid leave benefits, it is also more likely that they don't have actual access to the care policies that they need. The Center for American Progress and the National Partnership just came out with a brief today. It was not perfectly timed. We were just lucky and fortuitous that it came out today about Black women and paid leave. And some of the numbers I think are telling. In a given year, 2.9 million leaves are needed by Black women. Only 38% of them can actually, 38% of them aren't taken at all. 1.1 million of them aren't taken because they can't afford to leave their jobs. And of the leaves that are taken, about 42% of those are taken for no pay. So what that amounts to is about 6 in 10 of the leaves that a little over 60% of the leaves that need to be taken are either not taken at all, or they're taken for no pay. And so it tells you something about sort of the gap that many Black women experience when they're trying to access care. And then of the ones that are taken, there is a wide range of what access to pay they actually have, right? So for Black women, we need to be thinking about many of the policies that folks have already mentioned around paid leave, around increased higher wages, access to affordable childcare. Like all of those things are really essential for Black women who are going to more than likely be in the workforce, more than likely have to provide care to families, but need access to the supports to actually make that possible. And I think Melissa spoke about this. Obviously, the solutions are not new, and they actually have been really clearly articulated in the Build Back, whatever we want to call it. I'm happy to call it the Primal Scream Bill, Melissa. That's right. And, I'm happy to scream along with everybody else because it is infuriating. And what I have said is that, we are in a moment where people are trying to engage in what I call pandemic amnesia, because they want to pretend as if what we just saw happen did not happen, right? If ever there was an example of why you need access to all of the policies that folks have mentioned, and paid leave, and all of the care policies that are so essential, not only for Black women, but for women, generally speaking, and anybody who has care responsibilities, the reason that you need those policies if you can't understand that after this pandemic, then you actually have not been paying attention. It is very clear about what happens when folks don't have access to these policies. And I think the reality, the unfortunate reality, is that there's sort of a mad dash to try to get through it, to talk about how we, have job growth, which is great, and people are going back, which is, sort of great, maybe, unless they're going back to a really terrible job or a really terrible situation, and sort of pretend like we just need to get back to where we were. What is clear is that we don't want to get back to where we were, because where we were actually was reinforcing a narrative that said that care was not worth investing in. And the last thing I would say is that I think Black women's employment experiences are really instructive of where we need to go. And I think at this moment, it is really essential for us to focus on what does it mean to actually create better employment situations for Black women. It is not simply about getting people back. It is about getting people back to jobs that have high quality, that have the supports that they need, and even investing in the jobs where women, Black women, women of color disproportionately work. That's why you need the investments in early child care worker jobs, home care jobs. Those are really essential to making sure that Black women and many women of color have access to not only good jobs that pay decent wages, but also that enable them to care for their families like we expect everybody else to be able to do. So I'll stop there and happy to answer questions.
I just got so much from that, pandemic amnesia. I'm thinking about making the jobs that women are in high quality jobs, making sure they have paid sick leave, they have wages, they have job security. All those things are really important. And before I turn to you, Elaine, I know you're chomping at the bit, maybe. I want to hear from Lina about her work with SEIU. And Lina, so you said that the union, SEIU, won't spend one penny or knock on one door for legislators who don't support a strong investment in care. What does that mean?
Thank you. I think we all know that SEIU is an election powerhouse, and we have done our very best over the course of the last couple of years to put true progressives in office. The reality is that everything that everyone has said, right? Working people, essential workers, Black and brown workers, mobilized in 2020 and 2021 to elect leaders with a vision for transforming our economy so that it works for everyone with no exceptions. And so our members and those of us on this panel and those of us who believe in this, right? We fully expect Congress to pass the full promise on Build Back Better, whether it's called Build Back Better or something else, right? The package itself will really get our country back on track to an equitable recovery, right? We've heard over the course of this discussion about Black and brown women leading the way in care jobs, and it needs to be equitable. If leaders that they elected don't pass bold policies that are just really responding to working people's demands, they can't expect those same voters, and we've seen this, right? We can't expect those same voters turn out again in 2022 or beyond. I'd say like what everyone should know is like, I'm hearing from workers, like we talk to workers every single day who are demanding change. They are fired up, which is why you see workers taking to the streets, showing up on Capitol Hill, making their voices heard. Legislators really need that same fire to protect the House and Senate for Democrats, and passing the full promise of Build Back Better, we think is, or again, whatever entity of it, will really deliver for every single worker who turned out for them. And so we're really anxious about what that's going to look like and really hopeful that we can get to the other side with all those promises.
Thank you. Thank you for that. And one of the things that as we've all been talking, we've been focusing a lot and talking a lot about care, but I also want to bring in child care, but also bring in the other piece of this equation, which is care for aging and ill parents, which many women find themselves sandwiched between, like raising and providing care for kids, but also caring for aging or ill parents. And I, in my work, and as people are thinking about work and where they're going to be in remote work, I've talked to countless families and women who have moved across the country to take care of ill or aging parents. And so really thinking about, again, the cost of that and what does that mean when we're thinking about building a robust care infrastructure and home care workers and the challenges there as well. And so to end our discussion, I wanted to talk to Elaine. And I want you to, if you could, just talk about, as we think about policies and think about like what has been and what has, kicked us down the road. The CARES Act is one of those signature pieces of legislation. But could you talk about how it's worked to reduce poverty among children and also reduce the harms from the pandemic employment declines?
Absolutely. So this has been incredibly fascinating. Thank you for allowing me to be here today. My personal story is that I started out as a child care worker, and I was like looking at Melissa when she's saying people don't stay in the field because there's no pathway to supporting your family. So I spent a few years doing child care work. I was a full-time nanny, and then I went off to graduate school, and now I am really concerned about how people are making ends meet and how can federal policy do that. And while tax policy is normally something that makes us shiver, it's actually been an incredible lift for folks in recent times. I'll say up front that tax policy is clunky, and it can be, difficult for people to access, but it can also be incredibly comprehensive. So it is the number one way we get money to families with children in this country. We spend more on tax policy for children than we do on Medicaid, which is shocking. And if you saw how little we spent on childcare, you would fall out of your chair. So it's important that we figure out how to access the tax system to move this conversation forward. And what I think about the tax system does really well, it delivers cash to people. So in the last couple of years, we've seen that happen a few times. The first is in the delivery of direct cash assistance through those economic impact payments. Those economic impact payments kept many, many people from falling out of poverty. They paid grocery bills, they paid utility bills, they kept people in their homes and in their apartments, and generally kept life moving when the labor market was falling apart. And then we got a glimpse of what could happen in a long-term future with tax policy in three distinct ways. The first is the earned income tax credit. We hear a lot about the earned income tax credit for families with children, but there's also a very small credit that goes to workers who do not have full-time custody of their children or primary custody. So this is one of the ways in that this tax system is clunky. That larger credit, the earned income tax credit for families with children, can only go to one person, even when there's two people caring for the child. So this childless EITC, as we call it, even though many of the people who receive it have non-custodial children, it was tripled. So it went from a $500 credit to a $1,500 credit. That's still half of what you get if you have one child, but it's on the way there. We also opened it up to younger people to sort of recognize that, even people who are under age 25 have needs. And this is a way that we can support paying for care, paying for child support payments, and these other ways that we can involve both parents in the tax system. The second is the Child Independent Care Tax Credit. This is a tax credit that used to go to only middle income families and high income families. So what we do in tax policy is we make it as confusing as possible. And the first thing we do is we sort of exempt very low income families from paying federal income tax. And the moment we do that, whenever we have a tax credit that only offsets taxes, we've already said we're not going to give it to the lowest income families. They cannot access the benefits. So the child independent care credit used to be exactly that. But for 1 year only, we said we're going to make it fully refundable. And by that, we meant every family can get the credit. If you are owed more credit than you owe taxes, you'll receive it as a tax refund. Now, there's some problems with this. It doesn't help to get a tax refund when you need to pay your daycare bill 6 months ago. But it was at least a step toward recognizing that low-income children are deserving of support, just like middle and higher income children. It's particularly important in the context of what Melissa was talking about, how the folks who are getting direct care from the government, it's like 1 in 8, I think you said, and they're very, very low income thresholds. So there has to be a way to build from this middle income credit down to lower income families. But the most powerful thing we did, which I'm sure you've heard about many, many times in this room, is the child tax credit. So we had a credit that, again, was upside down. No one would have designed a policy that said, my kids get $2,000 per child. And when I was a child care worker, I would have gotten nothing for them or very little. And so we made the credit fully refundable. And what we meant in this case was everybody received the maximum value of the credit unless your income was too high, as long as your children were citizens. And so we also increased the credit from $2,000 per child to $3,000 if you were ages 6 to 17, or $3,600 if you were under age 6. This built on years of research that shows us that investing in very young income children produces a lifetime of benefits, and it's where we ought to spend money. There's also a reason to give this bonus to under 6, because we know that most children ages 6 and up are in a public setting full-time most of the year. That's not true of young children. And so if there's a place where an additional subsidy is needed, it's there. And it's not enough just to work on the subsidy side to decrease those direct costs, because we know there's so much more to getting your child actually into the daycare. Most very young children must be potty trained, or you must supply disposable diapers. Sometimes you have to provide meals to your child care provider. Sometimes there are materials fees associated with even the preschools I taught at, which were just extra things on top that the regular subsidy system is not suited to deal with very well. So we need to put cash in people's pockets, and the child tax credit did that. The other thing we did with the child tax credit, though, is rather than giving it to you after the end of the year when you file your taxes, which is typically how we deliver tax credits, we advanced half of that credit from July to December. 61 million families were receiving a monthly payment of $300 per child, or $3,600, or $250, depending on how old your child was. And you got that in monthly increments. The moment that happened, you saw national survey data showed food insecurity drop by an astounding 25%. We saw child poverty drop by 40% because of these policies. So they're incredibly powerful. Research we did at the Urban Institute with the Center on Budget and Policy Priorities showed that prior to these changes, when we had a credit that you had to work a certain amount to access, and you couldn't access the full amount unless you owed taxes, left 27 million children in families that didn't get the full child tax credit, and they were disproportionately Black and Hispanic children. So this was a way to reduce that inequity that had been driven by the tax system. The final thing I want to say is that one of the things that remains that Build Back Better had originally tried to start to address is that tax credits operate on an annual basis, but we know that children and families do not operate on an annual basis. Children are moving in and out of homes. They are moving between caregivers. There are multiple caregivers sharing care responsibilities for any given child. But at the end of the year, only one person gets a child tax credit. So the original House passed legislation was to find some ways that we could split that $3,000 over multiple caregivers to recognize that there are multiple people contributing to a child, and also recognize that these changes are not operating on a calendar year like the tax system does. My final thought is that I believe in putting good intentions into the world. I do not believe the Build Back Better program is dead. I believe that if we, tell our Congress people what it means to deliver these benefits, we can still get them across the finish line. And so I am hopeful that in a year, we will be back here talking about what another year of advanced payments did and how that affected families with children, and building an evidence base that shows when we provide support for families, they can do good things.
So I'm all about the good intentions in the world, into the world, so we can get what we need. And I've just really enjoyed this panel conversation, and I hope that you all did too. We have about 15 minutes. I want to open it up to questions from this audience, this live audience, and also online. We do have a few questions on online, but if there's anybody in the room who has a question.
Not a question, just a comment. My name is Regina Malvo. I'm the director of the Washington State Women's Commission. I work for Governor Inslee, and this is my first time back in DC post-pandemic, and I'm so excited to see all of you. That's the first thing, but I went to Howard University School of Law as a single mom with a 5- and 7-year-old, and entered that field and this work precisely because of these childcare affordability issues. And so I'm just so grateful to all of you, particularly those on the panel who I know both in person and online, who've been working on these issues for a couple of decades. So thank you. The fact that we are in this moment in time, and I believe in intentionality as well, I also understand the reality of the politics. It's such a rare moment that I think those of us who are here have to try to believe and, force our will upon our elected officials. And just, so really just wanted to thank everyone who's here for all that you're doing, because it's such a rare moment in time that, we have to make it happen.
We got to make it happen.
Yeah.
Yes, back in the.
Really wonderful opening plenary for this very timely conference. So I congratulate all the speakers and Nicole, and I do the VPR. Your presentations brought a lot of questions. I have to choose a couple so that I don't. One question I have is about that. We talk about care infrastructure. So I think we have we are in a momentous period, but we also need to think about the way the delivery of care services, I'm talking now about the paid care sector, is organized and structured. Because the one thing that struck me when Melissa said, okay, look at the supply side, they paid very low. By the way, I'm an economist by training, right? And then the demand side is very high. So where does that gap between what's paid to the care workers and what's being paid by families is going? And I think we need to think about the structure, not just about the labor, but also how it's delivered. And that brings up the whole question of what's the role of government. Obviously, or in this room to discuss about public good. So my question, the next question I have is, there a need, because it's a public good. We don't want to have the kind of system we have on the health care system, where the most expensive care system in the OECD countries per capita, but very poor delivery. What's the role of regulation and monitoring in the care infrastructure?
I think this is I'm going to let everybody else speak, but when we think about the healthcare system, for example, in ACA, we put the ACA into a broken healthcare system. And so again, when we think about the overhauling the care infrastructure, we have to be really intentional about how we overhaul it, and we don't just pump dollars into a broken infrastructure. So I just want to say that and turn it over to Melissa.
Sure. So we could talk about this for a really long time, but one of the elements or the components of the bill that is, currently under discussion and negotiation is that there's 3 years of a buildup before you get to year 4, where there would be a child care entitlement or guarantee for the first time. And those 3 years are for states to build up their supply, for them to build cost estimation models to sort of get at the wage scale, all of these different things. Each of those points is a very important point for policy. Whether that is the regulation coming from the federal side, or whether it's the way that states are building out their plans. And also, I would say the process through which they do that. One of the things that we are a big advocate for is the people who are the experts in the childcare system are the parents and providers. Mm-hmm. They're the ones who have lived through its brokenness. They're the ones who should be consulted throughout as it is built. And we need to make sure that our state governments, that through the regulatory process, that there are multiple avenues for those voices and experiences to be centered. Because that can also affect, there's parents of children with disabilities. There's parents for whom English is the second language, and they might want their early years to be with someone who speaks their mother tongue. There's all kinds of ways in which we need to make sure that as we're building the supply of childcare, that we are actually responsive to the needs of parents. And to the providers who, again, we want to be recruiting more of them and retaining them in the field. So I would say that if in the scenario that we pass something that looks like Build Back Better, there is going to be an enormous amount of work early on in the regulatory process and in the at the state level with state leaders and parents and providers organizing to make sure that this gets equitably implemented. And I'm happy to talk about either offline or at a different time, what some of the key points are, everything from licensure to the cost estimation model, to all the technical wonky details that really matter in people's lives.
Great.
I was wondering if someone could comment on immigration and immigration restriction and that impact of that on the care work, the supply of care workers, because we've seen both with the pandemic and before the pandemic that there had been changes to immigration patterns in the US.
I don't want to cut off the people in the, if someone wants to take it online, but I'm also happy to speak to that. Okay, well, about 1 in 5 childcare workers is an immigrant. And one of the things that we saw, for example, during the Trump administration, when you had the public charge rule changes and other kinds of draconian immigration measures, is increased stress amongst those providers, as well as people being unable to actually to come and to do the work, this critical role. And so immigration policy is hugely important and germane to care policy, both from the perspective of the workforce and its availability, but also from a child development perspective, because we know that when caregivers are stressed, that it translates then into provision of care. And so I think sometimes when we think about child policy, we're only thinking about the child, but in reality, the adults and the caregivers in their lives, and making sure they are supported and not worried about deportation, or not worried about, not being able to sponsor relatives because their incomes are too low, is something that is really, really integrated. And so it's something that we've engaged on in the gender justice community, and helping to lead comments from the women's community on public charge and on other kinds of immigration, regulations.
Lina has raised her hand.
Lina?
Hi, thank you. So we are mostly focused on childcare jobs, but in home care, we definitely know that there is a gray area of individuals doing this work with their family members who are not getting paid, who are not being recognized. And one of the questions that has come up for us is whether or not should have the Senate overrule the parliamentarian when she blocked the path to citizenship and what that means. You know, her flawed opinion is not the final word. And so we think that it represents yet another example of how the system doesn't work for working families, for working people, and how it just never has. And we need to figure out how we unrig these rules and just look towards stop letting this broken Senate block. Will Senate block the will of the people? And we need to really make sure that our senators are doing every single thing possible to win the most protections for people right now. Workers from all races and all backgrounds, like we've heard folks on the panel talk about this, you know, have turned out to demand transformative change. And this means that we need to be investing in Black and Brown and API workers who are the backbone of our economy. And we need to be delivering on a pathway to citizenship. So putting down a payment, putting a down payment on good paying union, home care, care work, care jobs is so important to this. And Congress and the president, you know, they just have an obligation to meet the demands of the workers. And for us at SEIU, delivering a pathway to citizenship and fair and human immigration reform is the way to do that. Immigrants are our care workers. They are doctors, they're teachers, they're working in offices, hospital cleaners, first responders. We saw this all throughout COVID. Millions of them have risked their lives during COVID-19 and the continuation of this pandemic, and they deserve to be respected and protected and paid for the work that they've been doing.
Just one other point that a lot of times people don't think about is that oftentimes for the unpaid care work, older siblings and immigrant families are oftentimes providing care for younger siblings. And that can also affect their own economic mobility to focus on school or to be able to engage in, you know, activities or development that helps with college or whatever it is. And so that's true across a range of families, but it's disproportionate in immigrant families and lower income families. And so it becomes a cycle again around economic mobility. And so ensuring that we're supporting our immigrant families is really important again for today, as well as for future economic mobility.
So thank you, Lina, and thank you, Melissa, for answering that question. So I want to shift a little bit. I want to get on to Gary for a minute here, and think about. So we have the policies, we have the ideas. We take Build Back Better up to the House and to the Senate, and it stalls. So I want to talk a little bit about building the public will. How do we expand our understanding of who does care, the value of care, generating a broader narrative around care, the value. And so Gary, I'm wondering if you can talk a little bit about how we do that in a way so that we can build that public will.
Where to start on that one? I don't know. I'm not sure where to go on that one. Maybe I'll think about some countries that have done it well or have tried, and see if there's anything we can learn there. Let's think about, like a lot of you, I spend time thinking about Uruguay, for example. I'm joking about that, but I mean,
okay, I was like,
that folks don't think about, because they've got a national care policy. Passed during a progressive government. It's got a lot of these things in there. What have they made part of it to make it pass? And I think it ties to what several of us have said. One, it offers non-stigmatizing benefits to all households in terms of, and not just a tax credit, but actually saying that a cash payment to a household is not a bad thing, and destigmatizing that. It passed under a progressive government. It includes 3 months of leave. And I'll add another point that I think some other countries can help us think about. Other countries don't talk about weeks of leave, they talk about months of leave. Uruguay also has, and I think that's important as well, to say, once countries have put these in place, they hold up under conservative governments as well. The Scandinavian countries have seen that too. You get reelected by offering leave that everybody has access to. The other piece that Uruguay has done is between and here's another reason that folks won't stop, will keep voting for it. After you've had leave, I think it's 3 months in Uruguay, you can apply for a wage supplement to work part-time, women and men. Folks seem to like this a lot because they've discovered that at 3 months, babies can't walk and get the school bus by themselves, et cetera, that maybe care work takes a bit longer. All this stuff, right? Right-wing folks might call this populist and say that we're buying votes. Yes, we're buying it by providing it so that households say we want this and they don't step away from it. I guess some other ones along those lines as well. I would provoke a little bit on men doing care work, paid care work. There's been almost no movement in this country for 20 years of more men moving into doing paid work, whether it's child care workers or elder care. There's a few Scandinavian countries that have tried a few things to get at least a slight bigger percentage of men doing this, to make it normal, to see more men doing this, to see more men together with women, advocating for the higher wages to go along with it. Most of these that I'm citing, Nicole, are pretty much acts of desperation if we think about US politics. But I think to your point on the primal scream idea of just how do we think about benefits that everyone needs? Another one, Switzerland's been doing a campaign to convince men to work part-time because that's a middle income issue, right? Middle-class families in countries that are primarily middle class, it's mostly women who go to part-time jobs. Their wages go down, men's income, and they continue to climb the career path. How to make it normal that when we can afford it as families, that both of us perhaps are working part-time. That means 2/3 or 75%, making that something normalized as well. So I'm trying to offer some examples because it's a really tough one of how do we get US taxpayers to say we all benefit from this. It's not a favor, it's not an individual household decision-making one. I'm not sure if that was very coherent because it's a really tough one to say, how do we get the US populace to see these are goods and benefits that all of us need, and to bring men into part of the voting block to say we need those.
Yeah, and I think that to your point, like we do think that as a result of the pandemic, we know that we were having, many of us were suffering in silence or, figuring it out on our own, screaming on our own. And then we started to have these very private conversations publicly and saying, is this working for you? No, it's not working for me either, but it hasn't ever, so we know that it's a structural problem. So I do think we do know at least 50% of us, 50% of the population, women and men know. My question is, how do we, what else do we need? I think we do need some of these things and campaigns that, to broaden who does care work, but whose responsibility, who is that, who does that work? Yeah. Is it us again? So, Jocelyn. Oh, Jocelyn. Oh, thank you. Thank you, people.
Yeah, I just wanted to pick up on that point and what Gary was saying, because I agree with everything he was saying, but I think part of the problem is that we don't sometimes want to talk about what the problem is. And the problem is not that people don't understand the need for care. It is who they think does care, right? This is very much a problem about the fact that women do care, Black women do care, Latinas do care, API women do care. And the fact that they do it is not valued, right? Like it goes to, what are our perceptions about women and women of color? And I think we sometimes, not on this panel, but are afraid to tackle that problem, that so much of the problem is still rooted in racism and sexism. And so while I think it is incumbent upon all of us to try to elevate these policies, to talk about why they're important and so forth, it also is important to call out what the problem is, right? And to, you know, when you still have a Congress that is overwhelmingly white, overwhelmingly male, and who can sort of minimize the value of, you know, paid leave and sort of dismiss it as something that's nice to do, that, yeah, that's, you know, they understand care because they'll use care when they need care, right? Like they understand the importance of care. They just don't care about the fact that they don't have to do it, right? So I think it is important to sort of call that out for what it is. And maybe it just makes me feel better, right? Like I accept that, but it will at least, I think, put the problem front and center in a different way. And I do think that's important if we're really going to talk about how you tackle it, right? Like we need a national investment, not only in these policies, but also undoing a whole set of perceptions and stereotypes that are rooted in how we understand race, gender, ethnicity, and so forth.
Thank you, Jocelyn. And I think that just, you know, puts a fine point and ties everything we've been talking about today. So I want to end with where Elaine ended, where she said we should put our good intentions into the world and, you know, work towards us. So I want to end by asking everyone about your big moonshot. If you could do anything, wave a wand, what should we be doing? What should we be thinking about? What is your big moonshot around the care infrastructure?
So the number one thing I'm worried about is keeping the child tax credit fully refundable at any level. That is the key thing that puts money in very low income people's pockets.
Love it. Gary?
Ooh, I'd like men to vote like women and women to be paid like men.
I want to tax the patriarchy and I want to use the money to invest in care infrastructure.
She wrote that down on the paper.
Yes, this Elaine made this point very well, but this is also a problem of political. There's a problem of power inequality in addition to income and wealth inequality. And when we have a tax code that is allowing the concentration of wealth and power in the hands of very few, you get these skewed decisions where, you know, 4 out of 5 people support all of these things in a poll. You could ask them and they're like, yeah, do it. And yet our politics is stuck. And so there's outsized influence, there's outsized political power, and we need to be addressing that both through voting and organizing as well as through the tax code. Because until we build more power in our political system, we're not going to win.
Right. Mignon, what's your moonshot?
Gosh, I really liked everyone else's. So I kind of want to just say ditto. But I think that it is pressuring to kind of complement the other things other people have said, continuing to try to get people with good ideas and politics around this into elected office, and trying to make sure that we're supporting candidates that a care agenda becomes a thing that people need to have to get elected.
Jocelyn?
Well, I really like Gary's. I want women to be paid like men. I actually want women to be paid better than men, and sort of connected, you know, very much connected to the work that they do. But I also will pick up on what Mignon just said. At the end of the day, I think what's most important for women voters to really hold lawmakers accountable. Women drive elections. Most of the people in Congress and presidency are there because women put them there. But we need to do a better job of making sure that they're actually accountable and doing the things that they're supposed to be doing. So for me, that's the number one goal.
Thank you. Lina, take us home. What do you think?
So ditto to what everyone has said, but for me, it really rings home. I think what would be most important to me is seeing women of color who are doing these care jobs, who are really giving it their all, being paid for their work, like actually being paid for their work. Yes, we have to get to equality. We have to do all these things, but we're seeing so many women do this work at home. Someone mentioned, even brothers and sisters, but we are really in a place where women of color are running this economy and are not actually getting paid for the work that they are doing. And so until we get to a place where that is actually, it's reciprocal, right? You work and you get paid for it, and you're able to pay your bills, and you're able to put food on the table, and you're not dependent on other people, and you're not dependent on your family members around you to help you. Like you described, Nicole, about your childcare situation, my own childcare situation, right? We will not get anywhere, right? Because we will continue to see women of color used and abused in this economy. And it just pains my heart, and we just need to do very different for everyone.
That's amazing and a great way to end this panel. I just want to thank all of the panelists. This has actually been fun. Maybe it's because I haven't done this in a while, but I just want to thank you all, and I look forward to engaging with you over the next couple of days on some ideas, thinking about how we actually do this, and just thank you so much. So